Hi, today I am going to discuss on this MRI of a patient who is about 65 years old. She has been having chronic back pain for about 20 to 25 years, on and off back pain. Half late the pain got worse, severe back pain, and the pain is going to the legs. The right side leg has more pain and the left side leg is of more weakness. She could not walk more than 10 to 15 steps at a stretch, and she could not stand more than a couple of minutes. So that's her present scenario. She finally went to an MRI, and this is what the MRI looks like. So I'm going to go through what are the list of things which I see in this MRI that will help us to understand the nature of the pain that she is suffering from and what should be technically done to get rid of her pain. Okay. So this is the sagittal view. You see the full spine view starting from the cervical, thoracic, lumbar and sacrum. If you go to the lower lumbar spine, you could see the L5 and L4. The disc between the L4 and L5 is literally degenerated or desiccated. Okay, so you could hardly see any substance as a disc between these two levels. Plus, whatever disc is degenerated, it's also causing a mild posterior canal narrowing here. If we go to the other level, here also there is some sort of degeneration going on, so as in the higher level. So you can say in the sagittal view there is multi-level disc degeneration, whereas in L4 L5 there is severe degeneration which is also causing mild posterior disc bulge at L4 L5, also some bulge is there in L3 and L4. Okay. Apart from that, what you could see here, you see the blackish thick area. So those are all the ligamentum flavum. You could see in the sagittal view there is a ligamental flaval hypertrophy. And what is the canal diameter here? As you see here, the canal is of good diameter. Nicely the spinal cord is suspended in the cerebrospinal fluid. As the lumbar level starts, you see the spinal cord is struggling and it's getting sandwiched between the anteriorly located disc on the bodies and the posteriorly hypertrophied the facet joints as well as the ligamentum flavum. So you can say that this patient is having severe canal stenosis or canal narrowing, which is definitely going to cause severe back pain and the leg pain. So this MRI, based on its face value, you can say that the patient should have central canal stenosis kind of symptoms, which is more of pain going to the legs and causing neurogenic claudications and so on. So if you go to the cross-sectional view, we call that as a transverse view. You see here the L4 L5, this is the disc level cut of L5 S1, and this is the disc level cut at L4 L5. You could see here there is a severe canal narrowing, and there is a reduction in the intervertebral foramen. What is the intervertebral foramen space? You see here, this is a normal level, I would say, where the nerve roots are seen here. This white color substance is called as cerebrospinal fluid, and you could see here the left side intervertebral foramen and the right side intervertebral foramen. The intervertebral foramen space and the canal space is intact here, whereas as you go down L4 L5, because of the posterior disc diffuse bulge, the intervertebral foramen space on the left as well as on the right is completely narrowed, plus almost half of the central canal space is also compromised. So this patient is definitely having a neural compromise based on this view also. So apart from that, there is a mild bulge at L5 S1 as well, and L3 L4 also is having some sort of disc bulge, but the most severe level is L4 L5. Let me go through one more view. This is the coronal view. You are seeing the spine from the front. Okay, these are the lumbar spine. You see the disc space is somewhat preserved between L5 and S1, whereas the L4 L5, you see not only the disc space is reduced, but also there is a bony changes over here and over here. So that also is causing the lateral shift. You could see that there is a mild bending of the spine to one side. So this patient typically will develop a lateral shift, which is nothing but the body shifted to one side away from the pain, and that's one of her symptoms that she is experiencing of late. That's probably because the if you see in the coronal view, that you see here there's a bony breakdown here, the bony breakdown here, and some sort of disc bulges happening over the lateral aspect too. So that explains why this patient is having a lateral shift also. Okay, so this is my understanding of this MRI. Now what this patient needs. Okay, now I think the patient has exhausted all the options of conservative management, so she may have to go to surgical intervention. So in surgery, what probably can be done, I'm not a surgeon, I'm not an expert, but this is what I understand by looking at the MRI. There is literally no space between L4 and L5, so probably she may need an artificial disc replacement with microdiscectomy at L3, L4 level, with instrumentation between L4 and L3 and L4. And if she is not undergoing a artificial discectomy at L4, L5 level, then she has to get spinal stabilization procedure that covers L3, L4 and L5. So in all the three levels, she has to undergo spinal stabilization procedure. Along with that, the surgeon has to remove, debride all the hypertrophied ligamentum flavum, little bit of cleaning work he has to do, that will help these nerves to breathe some nutrition. Okay, so it's if she undergoes only microdiscectomy, in fact the problem is not discal problem, it's more of canal stenosis, which is due to the ligamentum flavum hypertrophy and fascia joint arthropathy. Okay, so that also has to be surgically little corrected so that the overall canal diameter can get increased. With all these things done together, then the space for the nerve will be relieved, and the nerves can conduct the impulses normally. With that, the patient can have less pain or no pain. Okay, this is my understanding. Thank you.